I actually grew up in a medical clinic, so my mom was a doctor. The medical clinic was actually attached to our apartment. So I would go in with patients with her when I was little and she didn't have another babysitter, and I would help her. I'd be her little assistant. And I started that at a very young age. The first time I visited a pharmacy with my mom, I was 5 years old. So I said, "Mom, I think I want to be a pharmacist." Pharmacy was really a great choice for me because I was super interested in chemistry and how tiny little substances can impact our bodies and completely change our metabolism, completely change how we feel, how we think, how we act. I started feeling unwell during my first year in undergrad after getting a bout of mono, Epstein-Barr virus. I never felt like I fully recovered. I went from this really energetic kid who was bright-eyed and bushy-tailed, up early, ready to take on the world, to basically sleeping all the time. My health kind of took a downward spiral and it just kind of kept declining. I had fatigue, and then I started having irritable bowel syndrome. And then I started having acid reflux, hair loss, and carpal tunnel, horrible allergies. And that was when I had already been a practicing pharmacist for about 2.5 years. When I had started working as a pharmacist, I kind of came to realize that maybe not all doctors were created equally. Traditional medicine didn't really have an answer. If you had irritable bowel syndrome, well, that's kind of what you had. If you had chronic fatigue syndrome, then you just kind of lived with it. I always believed in cause and effect. In pharmacy school, we learned that basically lifestyle interventions were often much more important than medications. In a person with a chronic health condition, you often will want to do both. And I ended up finding doctors that were willing to do more comprehensive testing on me. Finally, those doctors were able to find that I had Hashimoto's and autoimmune thyroid disease. The only recommendation they had for thyroid disease was to take thyroid medications. I didn't want to give up. I thought that all of my symptoms had to be somehow connected. Then I just thought to myself, there's got to be some lifestyle factors that contributed to this condition. There's got to be some things that I can do to make myself feel better. There's got to be some things I can do to help prevent the progression. What can I do as a patient, as a person with this condition, to give myself the best possible life? I really want to empower people to take charge of their own health and to start doing some things to make themselves feel better. Really, all I've ever wanted to do was help people with their health. I'll get letters from women who have had miscarriages, who actually have been able to deliver healthy children after reading the book and implementing some of the lifestyle strategies. I've heard from people who didn't have enough energy to play with their kids, and all of a sudden now they have all the energy to be the moms that they want to be, to be the wives that they want to be the entrepreneurs or go-getters that they want to be, athletes that they want to be, academians that they want to be, bridge players that they want to be, and it's just really great to see. I think when a person who's healthy has 1,000 dreams, a person who's not healthy has just one, and it's to feel better. And when you can give somebody their health back, they can go after all of their dreams.